ਅੱਜ ਦੇ ਸੈਗਮੈਂਟ ਵਿੱਚ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਾਂਗੇ ਪੈਟਰਿਕ ਮੈਕਗੈਵਨ ਨਾਲ, ਜਿਹੜੇ ਕਿ ਪ੍ਰੋਫੈਸਰ ਹਨ ਯੂਨੀਵਰਸਿਟੀ ਆਫ ਵਿਕਟੋਰੀਆ ਦੇ ਵਿੱਚ ਅਤੇ ਡਾਇਰੈਕਟਰ ਹਨ ਸੈਲਫ ਮੈਨੇਜਮੈਂਟ ਪ੍ਰੋਗਰਾਮ ਜਿਹੜੇ ਕਿ ਇਸ ਯੂਨੀਵਰਸਿਟੀ ਵੱਲੋਂ ਚਲਾਏ ਜਾ ਰਹੇ ਨੇ। ਇਹ ਪ੍ਰੋਗਰਾਮਸ ਦਾ ਮੁੱਖ ਉਦੇਸ਼ ਹੈ ਕਿ ਲੋਕਾਂ ਕੋਲ ਜਾ ਕੇ ਉਹਨਾਂ ਦੀ ਹੀ ਜ਼ੁਬਾਨ ਦੇ ਵਿੱਚ ਉਹਨਾਂ ਨੂੰ ਦੱਸਿਆ ਜਾਏ ਕਿ ਕਿਵੇਂ ਆਪਣੇ ਲਾਈਫ ਸਟਾਈਲ ਵਿੱਚ ਚੇਂਜਸ ਲਿਆਏ ਜਾਣ ਤਾਂ ਕਿ ਉਹ ਇੱਕ ਬਿਹਤਰ ਜੀਵਨ ਬਤੀਤ ਕਰ ਸਕਣ। ਇਸੇ ਸੰਬੰਧ ਵਿੱਚ ਆਓ ਜਾਣਕਾਰੀ ਲੈਂਦੇ ਹਾਂ ਕਿ ਇਹ ਪ੍ਰੋਗਰਾਮਸ ਜਿਹੜੇ 3 ਸਾਲ ਪਹਿਲਾਂ ਸ਼ੁਰੂ ਕੀਤੇ ਗਏ ਸੀ ਅੱਜ ਕਿੱਥੇ ਖਲੋਤੇ ਨੇ ਤੇ ਫਰਦਰ ਪੈਟਰਿਕ ਦੇ ਕੀ ਪਲਾਨਸ ਹਨ। ਵੈਲਕਮ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ।
Thank you.
Thank you. So the self-management program concept, of course, it has been continuing for a long period, but 3 years back with your initiative, you introduced the Punjabi version of this. How successful you have been?
Well, we've been quite successful. In fact, this last year, in the Fraser Health region, about 1,050 people actually participated in the program.
Okay.
And these are the programs that we have going in English, in South Asian language, in Punjabi language, and there's actually 2 programs that we've been implementing in Punjabi language, the diabetes self-management program and the chronic disease self-management program.
Right.
So I'd say that's quite good.
Okay. So when we talk about chronic diseases, self-management, and then the other one is the diabetes. So what was the need? Why did you feel that there needs to be an introduction to these communities also in their own languages?
Okay. Well, first of all, with chronic health conditions, they're a little bit different than acute chronic conditions.
Right.
Like acute conditions like appendicitis, or you break a bone, or you get rushed to the hospital and they fix you. And we have a good acute care system.
Right.
But as time goes on, and I think maybe in 1930, 1940, a lot more people started to develop chronic health conditions. And chronic health conditions are conditions such as diabetes, arthritis, osteoporosis, COPD, heart problems. And the way that you handle chronic health conditions is a little bit different because people have to be involved.
Right.
Okay. So you can't just tell a person, you know, go home and change your diet, or you know, go home and start exercising, because I mean, it's hard to do.
Right.
I mean, most people would find that really hard to do. So we have a program that was developed, first of all, at Stanford University.
Right.
And it's been well researched around the world, and I think it's 25 countries around the world where we have the program, and everywhere across Canada except Nunavut.
Okay.
And the only reason why is because I guess it's just too complicated in Nunavut
Right.
now. And this program gives people the skills that they need so they can manage, because people don't see health professionals for much time. Like an average Canadian with a chronic health condition, maybe let's say a couple of visits a year.
Right.
You know, maybe see it 4 times. So that means that people actually manage by themselves.
Right.
So 99.999% of the time a person is managing by themselves.
Right.
So that's why they need these skills.
And even the government now has started accepting this, that of course prevention is better than cure, it's always known.
Of course.
So now this changes because when you are knowing about something and you are self-managing yourself, definitely those results can be good.
That's right. And when I say self-management, I don't mean managing without the involvement of health professionals.
Of course.
It's working with health professionals, but as I explained, because you're living by yourself so much greater percent of the time, you have to know what to do, because you can't be asking health professionals, what should I do? What should I do?
Lifestyle changes.
Lifestyle changes, yeah.
Right.
Yeah.
And also, as you said, Peter, that the incidence of heart attacks, cholesterol, diabetes amongst the South Asians is much more as compared to the other communities. And of course, research also is being done, and it's all genetics and our eating habits and everything. So these programs which have been made in accordance with the Stanford University, what you talked. So are there, you know, kind of culturally sensitive also?
Yes, yeah. The programs have gone through cultural adaptation, and the same principles that work for encouraging me to change my eating habits, or to try to get me just to start walking, work in the South Asian community as well. Yeah,
absolutely. And as far as the diabetes is concerned, that also program is that was introduced after the chronic management program was
That's right, yeah.
So where does it stand today?
Well, it stands that we have ongoing diabetes programs offered in, first of all, if you can speak English, you can take the program anywhere in the Fraser Health region, because there's lots of programs taking place.
Right.
But if you just can speak, let's say Punjabi only, then we have a Punjabi coordinator in Fraser Health. His name is Jay Baines.
Right.
And then we have numerous people who we've trained to lead the program. They're called our program leaders.
Right.
Okay, and then all the people who've taken the program, and as I say, this year quite a few people.
Right.
Yeah.
So when we say normal people also attend a kind of a workshop, what is the procedure and how anyone can be involved? And it's not just necessary that anybody who is suffering from these diseases, anybody can come and take advantage of this knowledge.
That's right. And sometimes family members come because, for let's say, Mr. Jones has diabetes. Well, Mrs. Jones lives with Mr. Jones, so they both come together so they can both learn.
Right.
Because, as I said, people live their whole life with a condition. Yeah.
And as these programs are running, and anyone can be a part of this, but what are your future plans? Because this was a plant which was, the seed was sown and it's now sprouting nicely.
Yes.
University of Victoria, is it planning something else also? And you being the director of this particular program, what are your future plans?
Well, we're trying to integrate the program as much as we can. You know, just another example. Let's take an example of let's say, young mothers and young mothers who are overweight.
Right.
And they get married and they're going to have children. And during pregnancy, they develop gestational diabetes.
Right.
Okay. Now, the child is born and the child's healthy, which is good. But then there's a high probability later in life that that mother will develop type 2 diabetes.
Right.
So we're offering the program especially for women who have had experienced gestational diabetes, and we're doing that both in English and in the Punjabi community.
Right.
So, yeah.
So this is what is being offered, and
That's
along
been
with
offered.
that, while you are bringing in the programs, any kind of challenges you are facing or what you are asking from the community?
Well, the community has been really, really good. Okay, there's a lot of support from the community. And it's almost like we're doing the best we can to get as many programs as needed,
right,
so that people can come. And anyone can attend the program, even if you don't have a diagnosis, even if you have a problem or you feel you have something. All you would have to do is just call our telephone number, and you could register a program. And the programs don't cost any money.
Right.
I mean, they do cost some money, but it's being supported by the Ministry of Health.
Okay.
Yeah.
And towards the end, as I asked, any major emphasis in the future on what you are planning, or you're just going to develop these programs only?
Well, we're trying to implement as many possible, you know, to train more and more leaders so that the program could be delivered in all different places.
Right.
Yeah, our emphasis is to try to get the programs taking place as close to where people live as possible, not just in big centers.
Right.
Okay. And we're working with health professionals as well, because health professionals have become very interested in this program.
Right.
And quite a few health professionals now have taken the training for this program too, so they can learn the techniques.
Okay.
So that when a person with diabetes is maybe at a diabetes education center, when they start talking about action plan, it's the same action plan that they learned in the community.
That's right.
Yeah.
Wonderful, and best wishes. This initiative which was taken is really bearing fruits now, and congratulations for taking the initiative, and best wishes from all of us.
Good. Thank you very much.
Thank you. ਸੋ ਅੱਜ ਇਸ ਵਿਸ਼ੇ ਤੇ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਰਹੀ ਪੈਟਰਿਕ ਮੈਕਗੈਵਨ ਨੇ, ਜਿਹੜੇ ਕਿ ਪ੍ਰੋਫੈਸਰ ਹਨ ਯੂਨੀਵਰਸਿਟੀ ਆਫ ਵਿਕਟੋਰੀਆ ਦੇ ਵਿੱਚ ਅਤੇ ਸੈਲਫ ਮੈਨੇਜਮੈਂਟ ਪ੍ਰੋਗਰਾਮਸ ਜੋ ਚਲਾ ਰਹੇ ਨੇ। ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਇਸ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਕੋਈ ਵੀ ਵਿਅਕਤੀ ਆ ਕੇ ਬੈਨੀਫਿਟ ਲੈ ਸਕਦਾ ਹੈ। ਜ਼ਰੂਰੀ ਨਹੀਂ ਕਿ ਤੁਸੀਂ ਬਿਮਾਰ ਹੋ, ਤੁਹਾਨੂੰ ਡਾਇਬੀਟੀਜ਼ ਹੈ ਜਾਂ ਤੁਹਾਨੂੰ ਕੋਈ ਕੋਲੈਸਟਰੋਲ ਦੀ ਪ੍ਰੋਬਲਮ ਹੈ, ਤੁਸੀਂ ਆ ਕੇ ਇਹ ਬੈਨੀਫਿਟਸ ਲੈ ਸਕਦੇ ਹੈਗੇ ਹੋ। ਅਤੇ ਇਸ ਵਾਸਤੇ ਤੁਹਾਨੂੰ ਰਜਿਸਟਰ ਕਰਾਉਣਾ ਪਏਗਾ। 3-4 ਦਿਨਾਂ ਦਾ ਇਹ ਪ੍ਰੋਗਰਾਮ ਹੁੰਦਾ ਹੈ, ਜਿਸ ਵਿੱਚ ਕਿ ਤੁਹਾਨੂੰ ਬੇਸਿਕਸ ਦੱਸੇ ਜਾਂਦੇ ਨੇ ਕਿ ਕਿਸ ਤਰੀਕੇ ਨਾਲ ਤੁਸੀਂ ਇੱਕ ਚੰਗਾ ਜੀਵਨ ਬਤੀਤ ਕਰ ਸਕਦੇ ਹੋ। ਇਸ ਵਾਸਤੇ ਕੋਈ ਵੀ ਤੁਸੀਂ ਜਾਣਕਾਰੀ ਲੈਣਾ ਚਾਹੁੰਦੇ ਹੋ ਤਾਂ ਸਕਰੀਨ ਤੇ ਦਿੱਤੇ ਹੋਏ ਫੋਨ ਨੰਬਰ ਤੇ ਕਾਲ ਕਰਕੇ ਆਪਣੇ ਆਪ ਨੂੰ ਰਜਿਸਟਰ ਕਰਾ ਸਕਦੇ ਹੋ, ਤੇ ਇਹ ਜਿਹੜੇ ਮੁਫਤ ਪ੍ਰੋਗਰਾਮਸ ਆਰਗੇਨਾਈਜ਼ ਕੀਤੇ ਜਾ ਰਹੇ ਨੇ ਇਹਦਾ ਬੈਨੀਫਿਟ ਲੈ ਸਕਦੇ ਹੋ।